developmental psychology, the developmental stages across a lifespan. So there are multiple reasons why it is important to study and learn about the development of humans, primarily to understand developmental stages through a person's life, to learn about yourself, to learn about the children that you have or the children that you may interact with, and also to be more aware of potentially problematic behavior and perhaps what the roots of that behavior may be, to begin to differentiate between normal stages of development and dysfunctional or maladaptive behavior. An important issue to bring up in this is that the languaging and much of the conceptualization of this information is really from a Western perspective and cultural understanding. This is just one way of looking at human psychological development. Embryology is an important piece, and I did speak about this in one of the PowerPoints from last week's learning about the genetic paradigm and the nature of genes and genetic expression. So this is just a continuation of that material. There are 2 short videos with the basics of developing fetus, important understanding about the development of the nervous system. There are divisions that become the nervous system, and during this early development, a huge amount of growth and changes are taking place with a virtual explosion of formations of the synapses. This plays the earliest of roles in learning and memory, and over time pruning begins to take place. With neural growth and synaptic pruning, that neural growth really begins within the first few weeks after conception, and by the 3rd trimester, the brain waves are detectable. Synaptic pruning happens in the nervous system to structures that are no longer needed or are no longer used. By the age of 2 or 3, an infant has around 15,000 synapses per neuron. Pruning happens from childhood through adulthood, and this is an aspect of neural plasticity which allows the brain to be efficient and mutually complex. So developmental and biochemically, most rapid pruning happens between the ages of 2 and 16. Between the ages of 2 and 10, about 50% of extra synapses have been eliminated. During adolescence, the process begins to slow and stabilize, and in early adulthood, most of the pruning occurs in the prefrontal cortex. So remember, this is the area that is responsible for decision making, personality development, and critical thinking. Neuronal death can be the result of high levels of cortisol, a lack of blood flow, or the buildup of harmful free radicals. So the concept of cellular memory, there are some pieces of this, like implicit memory and some common prenatal themes. So with implicit memory, it's that which is without words. It is a knowing that is outside of consciousness. The formation of implicit memory is under the control and regulation of the amygdala. This is important when taking some of these prenatal themes into consideration. So these are things that may be part of a conversation when discussing issues with clients and patients when they're considering or taking things into consideration that may be related to birth trauma. So we have to remember that there are issues that can happen at preconception, at conception. People might talk about things like incarnation shock or vanishing twin. People talk about things around implantation, toxic womb, and even mistaken gender. So these are often existential, and for some it is helpful to explore these. A couple people, a woman named Annie Brooke and a man named Ray Castellino, are just 2 sources for more exploration around those topics. Environmental adaptations or nurture. C.H. Waddington was a British embryologist and theoretical biologist who coined the term epigenetics. His work was inspired by both visual arts and poetry, and his work led to the understanding of how cells transform from a stage of undifferentiated to one of specificity during embryonic development. This also led to an understanding of the various influences of gene expression, and perhaps maybe explains why one twin may develop a serious mental health issue and the other does not. The Talking about in utero and prenatal is the time of conception to birth. So the interaction of both nature and nurture during this stage of life guides the inherited genetic material and is influential in which genes are expressed and which are not. Again, an exposure to any kind of emotional stressors, to toxins and nutrition all play a role in protein synthesis that goes into creation of a gene. There are truly 3 stages here. So beginning with germinal, this begins with the formation of the zygote and ending after about 2 weeks with attachment at the uterine wall. If there is not implantation, there is not a pregnancy. Often the person does not even know that they have had the potential of pregnancy. If implantation does occur, then a placenta and umbilical cord forms, allowing oxygen and nutrient exchange to occur, making what the pregnant person eats and drinks and is exposed to in the environment critical to fetal development. The embryonic stage occurs from 2 weeks post-conception until 2 months in utero, and this is critical for the development of major structures and organs. This is a time when birth defects can arise and may result in miscarriages due to issues around viability. With the fetal stage, this occurs about 2 months post-conception until birth. At this stage, both genetic coding and uterine environment play a critical role in the health of the developing fetus. There's something that is referred to as teratogens, which are environmental agents such as drugs, viruses, disease, or physical conditions that may impair development. You can think about things like folic acid deficiency and fetal alcohol syndrome, and other issues at this stage may be premature birth at before 36 weeks, which can cause issues with eyesight, lung development, digestive and immune system complications. And remember that low birth weight increases the chance of neurologic issues and even death. Moving on to perinatal, or around the time of birth. So in and of itself, this can be a traumatic experience for both the person that is delivering the child and the child itself. Even in the best of circumstances, problems can occur. However, I'm not going to be discussing those issues, but I will be speaking about motor and sensory perceptual development briefly as it relates to healthy psychological development. Starting with the primitive reflexes. So these are present to ensure survival. They are safety mechanisms. They help us to respond to the environment appropriately depending on the situation. The integration of these reflexes is important for healthy growth and development, not only physically but also psychologically. These reflexes are part of our autonomic nervous system. They are foundational to conscious movement, physical coordination, and sensory awareness. Much of the understanding discussed here is from the work of Dr. Annie Brooke. Starting with motor motor reflexes. These are unlearned or automatic responses to ensure survival of the species, many of which disappear within the first few weeks to years of life. If they are not present or fail to diminish, this can indicate developmental issues that can have long-term, lifelong consequences. These are things like the palmar or plantar grasp. So the palmar grasp is the flexion of the hand. Plantar grasp is flexion of the foot. These are functional reflexes and a response to stimuli of the hand or foot, ensuring safety and physical connection to the caregiver or the protector. There are reflexes of the spine and head, including the Moro reflex. This is also known as the startle reflex. So there's a loud noise, which is the stimulus. The back extends, the arms extend, eyes get wide, and all of this is a sympathetic response and should be followed by relaxation involving the parasympathetic nervous system. There's the tonic reflexes, include asymmetrical neck reflex, which is about developing awareness of the opposite side of the body, necessary for visual tracking, for later life learning how to read and write. And then there's the labyrinthine reflex, which is about head and postural stability related to balance and spatial orientation. There's the symmetrical neck reflex, which is necessary for crawling and walking and running, and failure of any of these to be integrated can create the appearance of learning disabilities like attention deficit disorder and low levels of concentration. Lastly, the sensory perceptual, which is about senses and perceptions. The development and sophistication over time related to both internal and external stimulus and response. As we mature, some of the primitive reflexes remain, developing into conscious choices and responses, meaning that they are retained. These develop into interoception, neuroception, and cognitive awareness of the self, which I will be talking about in a later PowerPoint. Disruption in extinction of the primitive reflexes can be the result of multiple factors, including developmental trauma. Some may be the result of accidents, genetic abnormalities, life-saving interventions, neglect, or even disruption in the caregiver-child connection. Understanding of issues during neurodevelopment can help to provide a view into later life physical issues related to posture, hand-eye coordination, and other fine motor skills. The sensory, motor, and cognitive development is a time when the connections between what is seen, felt, heard, and experienced. At its earliest, this is what is known as object permanence. So games like peekaboo are examples of practicing and developing toward object permanence or object constancy. There are 6 of these. So the first one is reflex acts. It is in the first month of life. These are responses to external stimuli. So things like brushing your finger gently across a baby's cheek or their mouth, they will reflexively begin to suck. If you touch your finger against the palm of their hand, they will reflexively grasp. Again, these are responses to ensure survival. Second is the primary circular reactions, 1 to 4 months of age. The repetition of pleasurable actions centered on the baby's own body, like wiggling your fingers, sucking thumbs or toes. These actions are done for the sake of stimulation, and it's intentional actions. Secondary circular reactions, 4 to 8 months of age, is repetition of pleasurable activities that now include objects in addition to their own body. So things like stomping their feet, shaking a rattle, repetitively beating on a drum, or other object that makes a sound. Coordinating secondary schemes, 8 to 12 months of age. So this is the beginning of goal acquisition through held knowledge. So the actions are done for an expressed purpose. For example, moving a blanket to retrieve a ball that was just covered up. The fourth one is tertiary reactions. Stacking blocks, knocking them down only to restack them. It's intentional object and reaction exploration. And lastly, the symbolic thought. The baby now forms a mental representation of an object. This is the ability to hold a mental representation for something that is not physically present. So just to kind of go over the developmental stages, just to let you know that there are famous theories and concepts around developmental stages, which I'm going to be talking about in the next PowerPoint. So you'll also see variations in categories like early childhood, childhood, late childhood. In a way, a lot of this just kind of comes down to semantics. So you can kind of conceptualize infancy is oftentimes thought of as birth to 2 years, childhood is often thought of as 2 years to 12 years, and so on. Sometimes you'll see it, going maybe to 18 months, from birth to 18 months. Again, it's just kind of semantic. So this is just a kind of a basic category of some of those developmental stages. So in summary, development of awareness of stages from the earliest embryological divisions through childhood can help to understand where issues may stem from. So the nature or nurture piece is knowing that it is a combination of both, that one feeds and informs the other. The interactions are integral to healthy human development. And stages of early life, sensory, motor, and cognitive development play a huge role in later life learning. Here are your references.